Well, good afternoon, everybody. Glad that you could be joining us. My name is Jeff Wolf, and I am the director of the Center for Executive Education here at Mercer University. And I'm excited to be able to present Dr. Faye Sisk to you all today. Dr. Sisk is going to talk to us about economics and epidemics and some lessons learned over the past month or two. Dr. Sisk is a professor here of management at Mercer University's Stetson-Hatcher School of Business. And I'm going to let Dr. Sisk go into details, give you a little bit of a background on her background, where she's come from, how long she's been at Mercer, and then she'll start right into her presentation. Dr. Sisk, it's all you.
Well, thank you, Jeff, and thank you for the opportunity to talk about this topic. I've been with Mercer a number of years, almost 25 now, and I came into returned to the academic world after a career in business. And even while I was in business, I was connected to academia. I did adjunct teaching for the School of Public Health at Emory and also at the CDC Fellows, as well as doing some adjunct work at Mercer. But when I decided the time was right and the opportunity presented itself, Mercer invited me to join the faculty. And I have taught management. My major area is strategy, and my secondary area is healthcare. So I'm delighted to be able to bridge the gap between business and health in today's presentation. And so that's a bit about me and my areas of interest. So with that said, let me go ahead and start this presentation. Economics and epidemics, an enhanced ability to be accountable, an expansion of managing risk, and enhanced accountability. How I got interested in this topic was back in 2016, I wrote a paper for the Journal of Leadership, Accountability, and Ethics. And the abstract or preamble to the paper is as follows. Epidemics caused by infectious agents are expected to intensify with the expansion and penetration of emerging markets. The impact of these epidemics on global business can no longer be considered an unpreventable risk or black swan. This paper examines recent epidemics and suggests the importance of corporate responsibility as well as risk management strategies to mitigate global business disruption. Little did I know when I authored this paper back in 2016 that times would have changed so rapidly, and some of the ideas of this paper would come to fruition in the magnitude that we have experienced over the last several months. So these are some topics I'd like to talk with you about today. First of all, why should business care about public health and epidemics? What can business learn about infectious disease? Secondly, why are the important factors identified by the Institute of Medicine, IOM, that contribute to the emergence of microbial threats and impact business? What are these important factors? How can companies mitigate or manage this risk? Why are pandemics and infectious disease a strategic business consideration, not just a black swan in the global economy? And finally, what are 5 things businesses can do to be ready? So hopefully the magnitude of loss that we've experienced recently won't be repeated. So the question is this. We see this swan here in this graphic in the middle of this slide, but was this really a black swan event? Is COVID-19 really the black swan of the decade? And you've probably heard this term black swan. It's become very popular in the world of finance, and it has also been used quite a bit in the media recently. But where did the term come from? And what is meant by a black swan? It actually comes from a book authored by Dr. Nassim Nicholas Taleb, excuse me. He wrote the international bestseller, Black Swan, The Impact of the Highly Improbable. And so what does he mean by, or what is meant by, a black swan? A black swan is unpredictable, massively impactful, and later appear more predictable than were originally thought. Taleb is a bit critical of those of us in academia and business and statistics, and even finance, who seem to believe that the power of numbers and that the large number instances will supersede those that are outliers that really should not be of major concern. He talks about the fallacy of the standard distribution and how we can be lulled into complacency by believing that the outliers will not occur. But we do know historically that those outliers, those unexpected consequences or situations, have caused the most impact on business and business results. So, are we talking about a black swan here, a gray swan, a white swan, or perhaps even a gray rhino? A black swan event is something which can't be predicted and has a profound effect on markets, a profound effect on markets. We know a white swan is something that occurs commonly or is normal. A gray swan has significant but unlikely occurrences, but it should be anticipated. But I present to you, perhaps, are we really been looking at more of a gray rhino with this episode with COVID-19? A gray rhino is known as an economic risk that people choose not to act on, despite the potential for harm. As an introduction to this whole area of the black swan and what happens to us externally and how should we prepare for it, I'd like to discuss briefly a model that strategists use. I use quite a bit in my strategic management class, and it is simply an instrument to help us continually be aware of what's going on around us. And some would say that the problem with the COVID-19 response was lack of awareness. We know that around us there are political forces, economic forces, social forces, technological forces, legal forces, and the environment. And in this case, it was an environmental impact that led to an economic force that caused us to change our strategy. When we use an external environmental tool, such as the PESTLE framework, we're always looking for opportunities and threats. And in this case, we see the threats. And it is our challenge in the light of COVID-19 to find the opportunities. We know that we are connected. The world is indeed flat. And what happens in one part of the world will happen in another in a global economy. Two books by Thomas Friedman, Pulitzer-winning prize author and columnist, one being The World is Flat, and the other, Hot, Flat, and Crowded, remind us of how interconnected we really are. The World is Flat discusses technological connection between individuals in the world and the role that technology has in bringing us together, facilitating commerce, and lessening distance. In his book, Hot, Flat, and Crowded, he discusses how the behavior in one part of the world impacts another, particularly as it deals with environmental concerns. Yeah, and yes, we are in business, and business is global. Why are we in business globally? First of all, source of labor. Labor is simply cheaper in other parts of the world. Another major reason that we are in global business is because of raw materials, particularly from the emerging economies or remote areas such as Asia, Africa, and in areas of Australia as well as South America. How could we enjoy our Starbucks coffee without those beans from South America? Global business also provides for us remote sites for manufacturing, some by invitation with preferable tax arrangements and other kinds of construction, such as we see in the zones in China. Global business also provides for us channels for distribution, simply easier proximity or closer proximity to markets. And also the access to emerging markets, growing middle class. My recent trips to China and South America, one of the first things we did was look for a Starbucks. You walk through the airports in China and Kentucky Fried Chicken banners from Yum Foods are everywhere. Yes, we have access to markets globally. And as well, global players have access to us. As we see this occurring in reverse, where even in the southeast of the United States, we see major automakers, manufacturing plants in South Carolina and even here in Georgia. So yes, there is a serendipitous relationship between businesses around the globe. Even Disney is involved in global business. You may have heard that the Disney resort in Shanghai was one of the first to reopen in China as they began to see their curve from the COVID pandemic subside. But a very important work, and the real reason that I wrote this paper originally in 2016 was based upon a report by the Institute of Medicine in 2003. And the Institute of Medicine in 2003 updated an earlier report from the late 90s. And their concern was that there were factors that need to be considered and accelerated in terms of recognizing their importance to health, to policy, and decision makers. These 12 factors will be contributing to the spread of microbial agents in the 21st century, and they are a threat. We are in the 21st century, and we have seen the threat. Here are the 12 factors, and I apologize, this is a bit of a busy slide, but I wanted to simply bring out the main themes of these factors being microbial adaptability, human vulnerability, climate and weather, changing ecosystems, economic development and land use, technology and industry, international travel and commerce, the breakdown of public health measures, war and famine, lack of political will, intent to do harm, and poverty and inequality. Several of those were illustrated or are being illustrated now in the COVID-19 pandemic. First of all, the evolution of microbes. We have seen with each subsequent epidemic since the late 1990s, and of course, if we consider the early epidemic of the early 1900s, which was considered truly to be a black swan, we have seen a more rapid escalation in terms of epidemics in the late 20th and now 21st century. And much of this is due to the evolution of microbes. I believe in the COVID-19, we're on the 7th or 8th mutation of this agent. We know that zoonosis, which is the human to animal contact, has been accelerated primarily due to the breakdown of natural barriers. And these natural barriers are part of expanding business and expanding development. Technology and industry, or number 6, have provided new pathways for infectious agents to enter. International travel and commerce provides ready worldwide transmission. We saw that in February, one of the believed to be super spreader events of this recent COVID-19 epidemic was the potential closure of borders from Europe to the United States. That created an influx of individuals, and with that, a super spreader events, which we believe contributed to the distribution and pandemic spread in the United States. We know there has been a breakdown of public health funding and infrastructure. Public health monies have not increased, in fact, have decreased in recent years. And also the infrastructure to support those measures, particularly in the United States. And last but not least, the lack of political will. The inability to commit to shared responsibility, both domestically as well as globally. And perhaps not believing in a black swan. Zoonosis simply means that a disease is transmitted from animals to humans. The three animals that have been implicated in most recent epidemics include bats, birds, and livestock. Here is a list of some of the epidemics from the late 1990s or the late 20th century to the early 21st century. And we see that there have been a number that have occurred since the 21st century, accumulating in billions of dollars of cost to the economies globally. I began to even become more aware of this seeming escalation of global epidemics when I traveled with two different MBA groups in global studies, and were concerned about the ability to continue the program because of potential exposure. And in particular, this was the SARS epidemic, the MERS epidemic, and then most recently with COVID-19. But you can't say we weren't warned. There have been a number of popular press writings in addition to the 2003 Institute of Medicine. And one of them is a book written by Reed Wilson, who talks about Ebola and the global scramble to prevent the next killer outbreak. He's a bit critical of Ebola, but we were lucky with Ebola that it was limited primarily to the continent of Africa. And much of this was because of the readiness on the ground of healthcare workers to identify and isolate exposed individuals. As well as that, this agent was not as infectious as others and required a high degree of contact between individuals for spread. What Wilson challenges readers in this 2018 publication is, first of all, what does it mean to be prepared? And then secondly, who is responsible? He was complimentary of the US participations in an international effort to eliminate the exposure of the US to this infectious agent, but also was somewhat critical that it could have been better. Very popular these days in the media is Laurie Garrett, who has written a number of books. In 1994, she first wrote the book, The Coming Plague. She's been very critical of international leadership and the importance of leadership to ensure the development of protection for individuals in countries globally. She calls for a global early warning system, but she is not alone. Because in 2015, Bill Gates in his TED Talk laid out a very convincing case that we're simply not ready for the next epidemic. He shows through simulations and illustrations using the data modeling that he uses in his global health initiative that the incidence of one microbe and the prevalence that will result with a highly infectious agent, and the model he uses is very similar to COVID-19, that the ramifications globally would occur swiftly and would be profound. He was a bit of a sayer of the future. The next epidemic, we're not ready. Well, we weren't. The next epidemic, COVID-19, has directly impacted in a devastating amount to certain sectors of our industry, including air and travel, oil and gas, automotive, as well as insurance carriers. Some believe that these will be transitory. Others believe that these will be more long-standing. Some are hoping for a swift turnaround from this COVID impact. Others are more cautiously optimistic. The COVID-19 pandemic is a healthcare crisis with economic consequences. The interconnectedness amplified by the virulence of this emerging coronavirus has been exemplified and has impacted all of us. Is this indeed a black swan, or is this something that we should have expected? So the next question is, what's next? What are 5 things that business can do to make certain that we are not caught short again, that we are aware, that we do better? One of the first considerations is more on the optimistic side, and that is to look for opportunity. There was a Harvard Business Review study published in the Harvard Business Review and authored by Galatea and others, and it was entitled in 2010, Roaring Out of Recession. And the purpose of this paper was to look at the results of companies that did well after the Great Recession of 2008. As they say in their paper, great leaders know that how they fight a war often decides whether they will win at peace. Yet, as CEOs continue to combat the myriad of challenges thrown up by the Great Recessions, they are increasingly unsure about what strategic approaches to deploy. And so what these authors did is they looked at a number of companies following the Great Recession of 2007, the economic crisis, and looked to see what responses seemed to be the most productive or yielded the best results. And what they found was not companies that were offensive in strategy or only defensive strategy, but that combined both an offensive and a defensive approach. Examples of an offensive approach would be new markets or the acquisition of new assets, such as technology, and defensive, more enhancing of operation or potential even downsizing. Another consideration is risk management. Risk management is instituted in about less than 20% of companies. Less than 20% of companies actually have an enterprise risk management system versus an insurance system as a vehicle for risk mitigation. This is the opportunity for companies to sell risk management benefits, such as an opportunity to increase access to capital and trust, risk management as a way to expose where the vulnerabilities are in the firm. An example of a vulnerability that in all of the epidemics continues to escalate is that in the area of supply chains, much of which due to the amount of dependency upon multiple vendors for the supply chain. So some of the opportunities is to mitigate this risk through redundancy, to become transparent and to really understand the key suppliers and to optimize inventory. And another approach perhaps is that of the value of a shorter cycle or a multiple shorter cycles versus a total per unit optimization of cost. With a shorter cycle, we have intermittent vulnerability that can be contained versus an entire cycle in order to minimize cost, which may lead to vulnerabilities due to time, particularly in an area such as time as we've recently experienced. The third area is the one that has been the most obvious during this COVID-19 as an opportunity to improve, and that is in the area of health. First in health care, and the second in public health. One of the increasing tensions in our country and continues is healthcare a right or a privilege? Is it a social? Is it a social right, or i.e. social justice versus a market justice consideration? And the overwhelming evidence from this COVID-19 is that the inequities in the system itself have really displayed themselves, particularly in terms of disparity and certain populations. And these certain populations, those that are underserved, are the very ones that are considered to be, in most cases, are essential workers. For example, in our food production and food distribution services, and even in our healthcare services. So a major consideration or opportunity for leadership in business at this point is to really rethink the social versus market justice consideration. Next is acknowledgement that public health is crucial for business. Employees must be healthy, consumers must be healthy, communities must be healthy. And so there is a need for increased accountability and funding for public health initiatives so that we basically have a global awareness system, such as recommended both by Laurie Garrett and Bill Gates. We can learn from other countries. There's other ways to do this better. A beautiful example of this is South Korea. South Korea immediately screened, isolated to mitigate incidents and the prevalence of disease spread. As a result, when we look at any of the graphics of the number of cases and the economic result, we see that theirs was basically a flat line. Ours is simply a continuing upward trend. So we can learn from other countries. There are other ways or better ways to integrate our public health system with our private medical delivery. And we can look to other companies such as McDonald's, who have really taken a forward position on the importance of health and safety in their restaurants and for their employees. We know that if we listen to leaders in human resource management, one of the discussions now is about internalizing testing, tracing, and tracking. Because until our public health system becomes more robust in providing frontline workers or frontline employees to help us assist with this, we as employers must take on an increasing responsibility for safety, primarily in this case of the pandemic from infectious disease, for both our employees as well as our customers. Next is to balance and diversify. We know that diversification is a good financial strategy in order to offset potential loss. And on the bottom of this slide, we see the barbell. Talib talks about the barbell strategy in financial investments and the fact that we need to basically diversify so as to balance high risk and low risk investments, to take opportunities when they present themselves with high risk, and then also to completely offset that with complete loss with low risk investments. And so this idea of diversification is well known and is one that we need to perhaps consider bringing into our businesses. Diversification as a source of income, as a source of knowledge, and for skills, so that companies can look for multiple avenues of revenue stream, for multiple knowledge sources, and for diversification of skills. What this pandemic has done has become more of an accelerator of trends that we have already seen occurred before the pandemic. We have been moving toward more of a teleworking society for a number of years. Back in the 1980s, with corporate downsizing, we saw the first telework occur when there was the ability to transmit over phone communications from computers and allow primarily clerical workers to work from home. And the reason for that was we were trying to limit the cost of floor space in order to keep simply the physical plant at a lower cost. At that time, it was considered to be a cost advantage for overall expense of operation. We have seen in this pandemic that because of teleworking, we have been provided business continuity. And in addition to that, for a number of years, teleworking, not only because of the capability of technology, but because of a global economy with virtual teams and remote customers, we have been using technology and global communications as a normal way of doing business. This COVID-19 epidemic has simply accelerated that trend. We also know, though, that we have seen some unfortunate fallouts in addition to the major sectors I indicated before, and some of these companies in these different sectors will not come back. Others will be targets of mergers and acquisitions and will offer opportunities for those that have deep pockets or other kinds of resilience in the areas I listed above. We also know another trend that has been occurring a number of years is e-commerce. And we have seen some real opportunity for those companies that were able to diversify their business with e-commerce and to maintain operation during this pandemic crisis. In addition, we've seen food services do a tremendous job of shifting their services from in dining to customer pickup and delivery. And we've seen entire new companies such as Instacart, which for a number of years have been growing slowly, simply expand and boom in this COVID-19 pandemic situation. So flat, agile, and focused. Companies flatten their operations, become more agile and quickly act, and focused on ways to ensure business continuity through maintaining multiple income sources, increased knowledge, and enhanced skills. And last, communicate, communicate, communicate. Leaders have stepped forward in this pandemic, and the leaders are those who have been able to build trust. There has never been a time in which communication was more important to communicate with employees, more important to communicate with customers, and thirdly, more important to communicate with the community as well as shareholders. Leaders lead in a time of crisis, and we have seen some phenomenal leadership, and we've also seen some not so phenomenal leadership. So in time of crisis and communication, and in future epidemic situations, the ability to step forward, to influence, and to communicate is crucial for business continuity and business success. And now I'm going to entertain questions.
Hey, thank you so much for that presentation. We do have a number of questions that have come through, and I do want to remind everybody, feel free if you have some additional questions to go to your Q&A on the Zoom session, and I will be happy to read those off. But we do have a couple here, so let me start with this. As you talked about the different events that have occurred, and you talk about, or we hear in the news about the potential of a resurgence, possibly this fall or winter. Do you have a couple of bits of advice for people I guess especially as we talk about the non-believers out there, and for those non-believers who haven't gotten sick or haven't had close ones who have been affected, even though we all in one way or another have been, but maybe not from a sickness or God forbid a death. What are some of those lessons learned that they can begin to prepare for should we get a resurgence?
Well, it's actually kind of two questions. First of all, the skeptics is simply all we can do is say, look at the data and watch the trends. There are a number of excellent resources from the CDC as well as the local public health agencies, which can show you what's going on in your own communities to show that, unfortunately, COVID-19 is not totally diminishing in all localities, in particular the Southeast. Business continuity continues to be very, very important, and the concerns of keeping robust and to make certain that we are answering the questions of how we can maintain business continuity in this crisis. Now, you were asking me about individuals who were doubting, but you also put a second question in there. And quite honestly, as I got to thinking about the doubting Thomases, I kind of forgot the second part of your question.
The second part is more to do with the preparation for that going into the resurgence of if we should get hit with it in the fall or the winter.
Well, I think that the comment I made about business continuity and the way to be thinking ahead, should this happen to us again, what are those skills, knowledges that we need to have? What are the alternate streams of revenue? Can we put aside funds now so that we have, so to speak, a surplus? Can we make certain that our employees are identified and we have the adequate technology for teleworking? That is something the companies are having to do right now, putting in place policies and procedures to identify key workers so that the continuity of the business and their availability to keep doing business is not basically interrupted. I'm seeing the accounting companies or accounting firms have done a very good job of this, as they've been increasingly using technology over the last few years, and all this COVID-19 did for them is just simply amplify the necessity to become more robust technologically and to make that a center of their business practice. I think that model is true in almost all industries. Food, as I mentioned before, dining, the dining room now, alternate ways to provide food to customers. Selling retail, now selling through e-commerce. Educating, as we know, in the classroom, now educating remotely. So the interesting thing, and I hope everyone heard during this presentation, is this COVID-19 epidemic is not a one-time wonder. It's probably not a black swan. There will be other epidemics, but the idea is to have the idea and the understanding of preparation, as you just mentioned, and what are the things that we can have in place. We can know now what our vulnerabilities are from what we've just experienced and not repeat them again in the future.
Sure. So as you responded to that, and this is a question for me to ask, not one that came through, but you talked about business continuity, which I find very interesting. I think of succession planning, and when I hear that phrase, I think of senior management. I think of the C-level. However, looking how important it is for essential workers right now and the role that they've been playing in healthcare, in higher ed, in industry, in a variety of industries. Think about farming, think about meat packing and so forth, and processing. Companies, it seems to me, need to look at things differently from a succession planning now, not just at senior leaders, but essential workers. How do you prepare if somebody in a key role gets sick?
Well, there's a lot of discussion about that right now. And interesting, you brought up meat packing. I just happened to hear a discussion with the CEO of one of the major meat packing firms just yesterday. And there is a realization that perhaps we have not considered the safety of these employees, even though we're now calling them essential workers, because honestly, they were not as valued as the executive team. It's a bit of what W. Edward Deming did when he, so to speak, turned the pyramid over and just said that the individual closest to the customer is really the most valuable in a quality organization. And I think that's a lesson we can relearn. The safety of the employee. Even though we have OSHA requirements and individuals comply with OSHA for safety, the safety of the employee is becoming more obviously important in the light of something like a COVID-19. Who are those essential workers that we need to keep our business in force, ongoing, to be continuous? Is it really just the C-suite, or is it the individuals who are in the front lines in front of our customers? Again, a word from Deming, the idea of the importance of the employee.
It is amazing how that pyramid has turned upside down. I think we all recognize the importance of those individuals who are working so hard at our grocery stores. Look at the mail being delivered. Look at just a variety of workers that are out there now on the front line to be sure that we have resources. So with that in mind, another question that came through, and I'm gonna read it exactly as it is here. As a result of the pandemic, do you think we will have to adjust to a new normal way of living, including business? And then there's a part 2 or 3 to that. So maybe you want to answer that one first, and then I'll go to the next part.
Well, a new normal, I think, has already occurred. I don't know about you, but we're all in our homes. We're not driving, hours every day back and forth from a physical plant, whatever that physical plant may be. And many of us have been able to assume some of continuity, not all, as we talked about earlier with the meatpacking employees, meat plant employees. But yes, this is the new normal, and it has been coming. It has been coming, but again, as I mentioned before, what this COVID-19 has been is an accelerator. It has taken those trends that have been slowly emerging in our lives and in our businesses over the last several years and simply accelerated them, exposed the weaknesses of the current models that some companies had, and then escalated the strengths of others. So yes, I think it's a new normal. We will not be traveling as much. And that's because we don't need to travel. Not necessarily because there's just the fear of pandemic and the microbes, but indeed, is it really a business necessity? We know that the human touch is very important, but as technology continues to improve, the ability to become more in sense with our customers and our other employees and each other. You know, the 5 senses are something that we try to constantly emulate in technology. So the new normal, I think, will have more technology emulating the human and the human capacity to interact and feel and touch and communicate. Yes, we will still meet together, but the meetings together, I think, will be for very different purposes than just the general practice of business and everyday living. I don't know, I've gotten pretty used to my home delivery of groceries and going up to Kroger and popping the hood of my car and having the groceries put in. And I remember years ago in Atlanta, there was a delivery service that I had when my children were young that could bring groceries to the door. And that basically that business practice fell by the wayside because we weren't ready for it. And the technology really wasn't there to support the ordering process. Now it's a different world. And I think we'll continue to see that kind of change.
Right, right. The next part is more of a kind of your personal thoughts on this. What is your reaction when you see different cities still having problems with people not social distancing? For example, this individual noticed that many people in Daytona Beach, Florida, were gathered in large crowds, and very few, if anyone, was social distancing.
Well, it's like everything else. Life is a risk. And I heard a young man say this who was basically very proud that he wasn't wearing his mask because he basically was following the practices of others that he considered to be important figures in his life. It is a risk. We know it is a risk. And so if you're educated, you can mitigate your risk. Young people in Florida on a beach, closely packed together outside, are perhaps less of a risk that young people together, closely packed together in a bar in Florida. I mean, there's a risk factor right there in terms of the environment in which they find themselves. But they're foolish to consider that they are basically free from risk. And at one time, and this was unfortunate, the COVID-19 epidemic was thought to only impact individuals with pre-existing or the elderly. But every day we wake up with new findings that this virus has extended its reach in terms of vulnerable populations, primarily due to its mutation and its highly infectious nature. So what I would say is beware and be informed, and basically make certain that the risk you're taking is worth it.
Okay. I have another question here. We have a number of participants today from a number of our chambers of commerce here in the greater Atlanta area, and they represent different size organizations, but I know a number of them are small businesses, and while a lot of them as small may not be, that 500 group of employees that is considered small, but those that might be 10, 15, under 50 employees. Any guidance for them as they look to the future? I think you kind of mentioned earlier how people in the hospitality field, like restaurants, have had to change and adapt. But here you have a number of small businesses that are trying to figure out how to best operate. Anything different for them as a small company?
This is really difficult. It's going to matter a bit by business sector. If they're able to reach out and communicate, as I mentioned earlier, with their customers and their employees, keep their key employees identified, help them with any kind of federal assistance, help them to make certain that they're not caught up in this tangle that's going on right now between being paid more if you're furloughed or if you're terminated versus if you stay basically and you come back as an employee. There's a lot of tension going on in those benefits issues right now. But again, communicating with those key employees, those that are essential to keep your business operation going, and your key customers. If they know you have a plan and an idea for your business, and you're thinking ahead on their benefit as well as the business benefit, meaning their benefit, both the employee and the customer, they're more likely to stick with you. If they feel like you are not thinking ahead, haven't prepared, and are a little self-interested, they're less likely to continue with you once this situation subsides. But my idea was that this is an opportunity to really examine your business, to figure out where your weak spots are, to figure out how to strengthen them, to figure out where your dependencies are, and to figure out where potentially there is a new avenue for business opportunity that you had not foreseen. I know that's a bit of a glitter in generality, but that's at this point all we know for certain. But we do know certain that not everyone is going to come out of this as they did in the past. There will be winners and there will be losers.
True, true. You commented about this one a little bit earlier, and I don't remember if this was just in yours and my conversation prior to the start of this webinar, where we were talking about how long this might last, but one of our participants has asked your thoughts on when you think the virus could end. And I know you had commented again about some individuals out there who are looking at this in different terms. So you might want to share your thoughts on that.
Everyone just wishes there was a magic bullet. Everyone's, for a while it was hydrochloroquine, and then it was Tamiflu, and then it was vitamin D, and everyone's just looking for a magic bullet that will either cure us all should we become infected, or will prevent us and isolate us from being basically a susceptible host for this virus. This is an RNA virus, and it is more like HIV/AIDS than other viruses that we have seen. It is also, we know that, for example, in the HIV/AIDS situation, we've never actually gotten a vaccine. We've simply been able to concoct a series of agents and treatments, i.e. to mediate or mitigate the ability of the agent to compromise the host. So we're still learning every single day, and particularly because this thing mutates so much. We're not really sure what the entire duration of this particular virus is. As I heard Laurie Garrett talking the other night, as she said, it jumps from host to host, and it simply looks for another host to go to. So if we quelch it in one part of the population, it doesn't mean it won't go to another and then come back. And that's what everyone's worried about. The other thing we're very worried about here is, indeed, if we do produce antibodies to this agent, and if the agent mutates, will they still be effective, or is there potential for reinfection? Until we get more of the science, we won't really know for sure what the duration of this is. But I think we should prepare, and hopefully be surprised pleasantly if there is not a reemergence of this, for example, in the fall. But the graphics simply don't look that way. I've heard dire comments of up to 3 years, which is a bit upsetting. And so with that, what we mean is we need to be sure that we are very robust and that we can continue to understand there may be subsequent interruptions in our business, that we need to make certain we provide this continuity and understand that we're probably in this for a long time.
Well, I thank you for your comments on that note, not certainly from a doom and gloom perspective, but more being prepared. And I hear your overall message is we can all do a better job of that contingency planning, of that succession planning, of the being prepared. And it isn't so much of, gee, what if, and worrying about it, but thinking in advance that the likelihood that there will be additional viruses that will be new out there that we need to take care of will occur. We're better prepared, ideally, because of what we've gone through. And that, not that we're looking at the new normal, but things evolve and change, and those that adapt to change will probably be the ones who will survive and handle this the best, as going kind of with an attitude. So I want to thank you so much, Dr. Sisk, for a very interesting presentation. We didn't solve the world's issues, certainly, but I think you brought them to light and allowed people to really give some thought to how can they do a better job. I want to let everybody know, certainly at this point, this webinar has been recorded. It will be available on our website. You can go to Mercer University's Stetson-Hatcher School of Business site, and then scroll down a little bit on that main page, and you'll see our professional webinar series. So not only can you see Dr. Sisk's presentation, but we have others that started back in April. And then you can also register for future events that are coming up. And I want to make you aware before I say goodbye is to let you know that next week on Wednesday, also at noon, June 3rd, our next presentation will be on the 4 disciplines of execution, or referred to as 4DX. So until then, Dr. Sisk, again, thank you, all of the participants. We thank you for joining us, and we'll look forward to seeing you next week. Have a great week.